Okay, in this presentation, I'm going to critique the building of a privacy-preserving contact tracking infrastructure. Okay, so this is the basic system, or an outline of the basic system that has been outlined by Google and Apple on setting up the basic infrastructure for the tracking or the tracing of contacts. So what we really have is that Bob will be in contact with Alice, and there will be a Bluetooth advertisement that's sent from Alice to Bob whenever they're in contact, and then that ID is sent back to some trusted entity. We'll call them Trent just now, and Trent will be able to build up a contacts infrastructure to be able to identify when someone is proven to be infected, that they know who they should contact in terms of the contacts that someone has been involved with. Okay, so basically what we have is a tracking key. It's a 256-bit random key. So it will be almost impossible to be able to reverse back that tracing key because it is a completely random value. So what we do is that Alice will generate a daily tracking key, and that's based on a hash of the tracing key and the day of the tracking, and it won't be possible to reverse this back even through hash collision analysis because we have a 256-bit completely random key. So if Alice has been proven to have COVID-19, then this daily key is shared with Trent. So we'll try to see who Trent is in a little minute. But on a positive test, Trent will receive the daily tracking key. Then every 10 minutes, Alice will create a rolling ID based on this key that she's created, and and 10 minute, and then after each 10-minute intervals. This creates a rolling ID. It's not possible to trace back the rolling ID key to the tracking key. So when Bob and Alice come in contact, then a Bluetooth advertisement is sent from Alice's phone to Bob's phone, and then that will contain the rolling ID key. Possibly what then happens is that is passed to Trent to make some sense of it. If on each day that Alice is proven to have COVID-19, then Trent will have a copy of the keys that she is using for the daily tracking key and will be able to correlate her identity to Bob. So this is a very basic system, and really there are so many questions opening up for this. Let's look at some of these. The first one is, who is Trent? Who is receiving this information? And how can we make sure that they are not passing it on to others? Probably the most trusted entity is a healthcare authority, as people will typically trust a healthcare authority over governments, law enforcement, and private sector companies. So we need to understand who is receiving a copy of the daily tracing key. And probably what we don't want is that governments, law enforcement, private companies, and anyone can actually see these keys and they're passed on. So it's important that we understand who is Trent and who is the core of this, the trust in the whole infrastructure. Then we need to understand, where is Carol? So we bring in Carol here, and Carol is a COVID-19 tester. She has a lab, and she's proven to have good quality tests and can prove whether Alice has COVID-19 or not. then we need to integrate Carol into the whole of the infrastructure. In fact, if Carol has proven that Alice does not have COVID-19, then the daily keys, tracing keys, should not be sent to Trent, and that should be a fundamental thing inside the mobile device. A signed attestation of a trusted tester should stop the keys from leaving Alice's phone. Along with this, we need a way to make sure that Trent receives these tests of being positive or negative. Then Trent can update Alice's status as being clear, positive, not known, or suspect. Whenever Alice is proven to be positive, then we can have a tracking infrastructure. Whenever she is proven to be clear, then we could erase all of her data from the past and not actually include anything. And where's Carol's attestation, and what does it look like? Is it a certificate, a digital certificate that Alice carries around on her mobile phone, so whenever she meets anyone, she needs to go into a building or she travels abroad, she will show that digital attestation and prove that it was signed by Carol? And we need to have some infrastructure of testers across the world for an infrastructure of signers. So if Carol moves from the UK to the US, then the US will trust a UK tester. So in this way, we create an attestation of COVID-19 as to whether someone has it or not. And then there will be a digital way to be able to sign that and then give that to Trent. And also in terms of sending the diagnosis keys. In this way, Alice will be able to keep a trace of whether someone is clear, positive, not known, or suspect, and trust entities for testing labs. And what is Trent's role? Well, Trent's role is core to this, because Trent must keep the whole of the infrastructure around the contact tracking private. He has the trust of Alice. He needs to trust Carol to be able to test Alice. He then needs to make sure that he does not leak any information out into the government, law enforcement, private sector, and so on. So it's a core role that we must analyse the data that's going out, and it's not pseudonymized. It's not an identifier for Carol that law enforcement can trace back, but it is truly anonymised data so that the government can make sense of the information and understand health, population, demographics, and so on, and make some analysis, and academia can analyse the data. And also that law enforcement can make sort of judgments on how the population are dealing with lockdowns and so on. But it's important that Trent is involved in anonymising that data, and that the data on the contacts list does not leak outside. And then we have a key factor. This might work within a country, within one health authority, such as the NHS in the UK, but how can we then trust other health authorities and other testers in other parts of the world? So at border control, we possibly bring in another concept of Trent, and it's up to Trent to actually identify whether Carol has been tested to have the virus or not. And in this case, we bring in our trusted signers, and at a border control, Trent can actually test and inform a health authority as to whether someone who's crossing a border is clear, positive, not known, or suspect. And then, how can we trust anything that comes off the phone or anything that anyone sends us? For this, we need data signers. And in normal practices, we have some form of an identity for Carol, Bob, Alice, and Trent. If we need to, we can anonymise the signing process, so we can't actually pinpoint exactly who it was, but we can still trust the signature. So we normally do this with some key pair, where we create a public and a private key for each entity or each role which is signing. The health authority themselves would have their own public key and a private key, and anything that the health authority sent to the device or to anyone else would be signed by the health authority's private key and be proven by a public key. Any things that are coming off the device that are related to these diagnosis keys and daily keys would be signed by Alice's private key and then be proven by her public key. Anything that did not have the right signature on it, such as where Eve came along and actually sent diagnostic keys pretending to be Alice from her phone, then we wouldn't be able to trust those. So in this way, we need to create a place where we store trusted keys for identity. A typical place is with something like Hyperledger, where we can actually define core roles and then trust the signing process. Carol is obviously important here, and it's important that Carol can sign for an attestation of COVID-19. And where is Alice's consent in all of this? So Alice might be embarrassed by a message going to Bob. So it's important that we understand how we articulate to Alice how the whole infrastructure is going to work, so that when Alice comes in contact with Bob, she knows that the health authority will send a message to Bob to say that she has been in contact with him. In some countries, that might involve an explicit consent, where Alice is given the opportunity to broadcast their status or not. But it should also give Alice the rights to prove that she doesn't have it and to create an attestation that she has been tested. So in this way, we need to understand what Alice's consent process is inside this infrastructure. Okay, so I've outlined a few different issues inside a contact tracking infrastructure and how we could possibly build an ecosystem which integrated trust, governance, and which provided possibilities for consent.